If you love eating rice, you're not alone. So many people eat rice at least once every day. We also eat special rice during celebrations and at social gatherings. So if you've been advised to limit your intake of starch, giving up your favorite rice dish doesn't sound like a fun way to get healthy. Hi, I'm Dr. 𝐖𝐨𝐤. In this video, I'm going to give you a few tips to help you eat rice without the giant blood sugar spike and get some extra weight loss benefits in the process. Rice has two types of starch. There's the first type that you can digest, and this makes up the bulk of the starch in rice. Then there's a second kind of starch which your body cannot break down, and this is found in very small quantities in the rice. The starch that you can't break down and use is called resistant starch. Resistant starch has two big benefits. One, your body can't break it down into glucose, so it can't pass into your blood to raise your blood sugar. Two, seeing as your body can't absorb it, you don't include it when you're calculating the calorie content of your food. Resistant starch has other major health benefits, which I'll talk about later. So rice already has some resistant starch, but the more resistant starch, the greater the benefits. And guess what? You can actually increase the amount of resistant starch in your rice, and this is how to do it. First, you start by rinsing your rice thoroughly until the water is clear. Then you partially cook the rice for about 10 minutes and drain the cloudy water. Then you add fresh water and return the rice to the boil. And then you add 2 teaspoons of coconut oil for every cup of rice that you cooked. So if you cooked 3 cups of rice, you would use 3 times 2, that's 6 teaspoons of coconut oil. Then you allow the rice to cook completely, take it off the fire, and then the next step, which is very, very important, you put it in the fridge. When you finish cooking the rice, you refrigerate it, and you need to refrigerate it for at least 12 hours. When you're ready to eat it, you can reheat it in the microwave, or you can steam it gently in a pot with a little bit of water. So some questions you might be asking. Are there other foods that contain resistant starch? And the answer is yes. Legumes like beans and peas, potatoes, sweet potatoes, yams, green bananas, green plantains, tiger nuts. All these contain resistant starch. The next question, does resistant starch cause gas and excessive farting? If you take it in very large quantities, especially if you're not used to it, then this might definitely happen. Can I buy resistant starch on its own? Yes. Most of what you will find sold as resistant starch is actually raw potato flour or raw green banana flour. What are the other health benefits of resistant starch? Resistant starch can help in inflammatory bowel diseases like ulcerative colitis. It may also help to prevent bowel cancer. Can this method of cooking rice help me with weight loss? Yes, it can, because you're eating fewer calories and not stimulating your fat-storing hormone, insulin. Why pour out the water after 10 minutes? Pouring out the water reduces the overall starch content of the rice even more. And if you're concerned about losing the nutrients in the water, you can skip this step completely. And last of all, if you want to find out the best rice for diabetics, you need to watch this video next.